Good afternoon and welcome to our June edition of our Sidewalks to Science webinar series. Today we are excited to welcome Komen scholar Dr. Antonio Wolf as our presenter. Dr. Wolf is a professor of oncology in the breast and ovarian cancer program at the Johns Hopkins Sidney Kimmel Comprehensive Cancer Center and has been a Komen scholar since 2010. As a clinician researcher, Dr. Wolf promotes the implementation of research findings in clinical practice, including the use of biomarkers to help guide treatment decisions, and on issues of survivorship and quality of care of breast cancer patients. Dr. Wolf's Komen-funded research focuses on creating a prospective, well-annotated repository with patient samples and accompanying data to support research efforts and further explorations in multi-center studies, such as SPORE programs and the Translational Breast Cancer Research Consortium. Dr. Wolf is also examining how to improve communication with patients and caregivers in routine practice. Please welcome Dr. Wolf.
Hi, everyone. It is really a pleasure and a privilege for me to join you and present some ideas that I would call stories from so many, because all of us are trying to inspire each other in what I would call our partnerships in fundraising, research, and education and patient care. And I'm so grateful to all of you for doing what you're doing with the Komen 3-day events. My name is Antonio Wolf. I am a medical oncologist and professor in the breast cancer program at Johns Hopkins. My clinical practice is dedicated to the care of patients with breast cancer, and all of my ideas related to clinical studies, laboratory studies, and improving the ways we provide care to our patients with breast cancer come from my clinical practice. And it is indeed a privilege to be able to interact with patients in such an intimate setting. Our stories are a compilation of the stories of each and every one of us. Mine started at a very young age. I remember at the age of 8, with my father visiting a local medical school, and I was fascinated by biology and by science. So it's like around age 8, I kind of thought that I wanted to be a physician, which scared me a little bit when the time came to truly make a decision and make sure that I was not missing anything else. And I've been very happy ever since. I went to medical school in Brazil. I grew up in Rio de Janeiro. And in 1988, I came to the United States on I would call a 6-year plan. It's been almost 30 years, so I guess I failed in my 6-year plan. And a lot of it was driven by my passion for knowledge and education. All the medical textbooks I used in medical school were in English, and I wanted to be close to the source of knowledge. During my training, it was an exciting time because this is when, for instance, we learn about the drug tamoxifen as a treatment that could be used for patients with early stage disease and young patients with early stage disease. From a biologist standpoint, this is also when the genes BRCA1 and BRCA2 that are associated with an increased risk of developing breast cancer was identified in families with a high number of breast cancers in young women, bilateral breast cancers, ovarian cancer. And from day one, I was absolutely fascinated by the interaction between the clinic and between the lab. And in fact, this is also the time that I first got to know Komen. Around 1993, the first race of the cure in Maryland took place in Baltimore. And I was a fellow, and I attended the events with my leaders at that moment, Marty Abeloff and Nancy Davidson at Johns Hopkins. And it was a fascinating experience to realize the power of many. I've been back at Johns Hopkins since 1998. I am a professor in the School of Medicine, and I also have the opportunity through other venues to be involved in design of clinical trials through one of the NCI clinical trials groups, ECOG Akron. I am also an executive officer and a member of the steering committee for the Translational Breast Cancer Research Consortium, which I'll talk a little bit more in a bit, where we put together the minds of investigators from 19 academic breast cancer programs. And I also help with dissemination of knowledge as an associate editor for the Journal of Clinical Oncology, which is the premier oncology journal for all of us. And as I said, it takes a lot of effort. It takes a lot of effort from all of you, for many of us who also have been involved in fundraising. As I often say, no money, no mission. And I have always been incredibly impressed by what Komen has done as a steward for all the funds that all of you are so careful and so diligent to raise and ultimately fulfill Komen's vision, and in fact, our vision of a world without breast cancer and the promise to save lives by meeting the most critical needs in our communities and investing in breakthrough research to prevent and to cure breast cancer. Komen has been in this for a very long time. The organization, with the support of all of you advocates of individuals interested in cancer, those of us involved in research, Komen has played a critical role in every major advance in the fight against this disease, and in fact transforming how we talk about it and how we treat it. Remember when this was an issue of shame? It's hard to imagine that this was happening barely a generation ago. And thanks to the efforts of Komen and so many others, we now have millions of breast cancer survivors in the US. And it is absolutely astounding to look at data in terms of the 5-year chances of survival of breast cancer. Look at what it was in the 1970s. 3/4 of patients, 75%, were expected to be alive at 5 years. And 10 years ago, over 90% of patients were expected to be alive at 5 years. And that percentage keeps going up. And for patients with local disease without the involvement of lymph nodes, early stage breast cancer, the 5-year survival is close to 99%. And in fact, the numbers have been so good in terms of the success in breast cancer that of all female cancer survivors, breast cancer is expected to comprise about 40%. And the goals of Komen are very similar to the goals of our program at Johns Hopkins to improve the detection, diagnosis, prevention, treatment, and the survivorship experience of breast cancer with research from the clinic to the lab and back, by ensuring that we have high quality multidisciplinary care, medical oncologists, surgeons, radiation oncologists, plastic surgeons, radiologists, by educating the next generation of investigators, of clinicians, by educating patients and their caregivers, and collaborating. It takes a village across not just our medical school, our School of Public Health, School of Nursing, government, industry, advocacy, organizations, foundations, you name it. It takes a lot of people to make things happen. Funds from Komen, as you know, ultimately 75% of the funds generated at by each Komen affiliate is meant to be spent locally, and those funds also go centrally to headquarters and are used to train the next generation of investigators, to provide early career grants for junior researchers getting their start before they move on to bigger grants, but also funding helping support senior researchers and investigators, for instance, through the Komen Scholar programs, and I have the privilege to serve as a Komen Scholar, and also organizations like the Translational Breast Cancer Research Consortium. Locally, service initiatives to improve the care of the patients with a diagnosis of breast cancer can be used for special initiatives. And here at Johns Hopkins, about 10 years ago, Komen Maryland helped us get together and get started with a special initiative on survivorship, where we were able to bring individuals from our various schools of medicine, nursing, from the cancer center, who have an interest and an obligation to help improve the care of cancer survivors. Those are the figures I was discussing before. The number in millions of patients who are surviving breast cancer has survived cancer has continued to increase steadily over the last 40 years. And breast cancer comprises a large number of these patients. And you can see in blue how many patients are surviving a cancer diagnosis for 15 years or more. And when we look at a definition of survivorship, this is from the National Coalition for Cancer Survivorship. Survivorship begins at the time of diagnosis, continues along a process through and beyond treatment, recurrence, cures, and sometimes, unfortunately, patients don't survive their diagnosis, but we call them survivors as well because we want to improve their quality of life in addition to their quantity of life. And it affects everyone, not just the patient with a diagnosis, but those around, their support system, families, and friends. And the message is getting out. This is from the Institute of Medicine, now the National Academy of Medicine, on various reports to break down the barriers, improve the care of patients with a diagnosis of cancer, the quality of care, how to live well with chronic illnesses, how to deliver high quality cancer care, and also the pivotal report from cancer patient to cancer survivor, loss in transition, emphasizing the importance of interactions between cancer specialists and non-cancer specialists, not just physicians, but also advanced practitioners like nurses, nurse practitioners, social workers, anybody, nutritionists who is involved in the care of patients. And this is the effort we began at Johns Hopkins many years ago on a survivorship program that we call Survive and Thrive, where we try to bring individuals from all our various schools to improve the quality of the care we provide to patients with a diagnosis of breast cancer. And in fact, we have been fortunate to have enough going on among us to be able to just in April of 2017 organize our second CME symposium on cancer survivorship, improving outcomes and promoting patient-centered care, when we brought more than 100 individuals from our region and afar to spend a day exchanging ideas and discussing best practices. And this is a success, and these are the types of events that Komen has helped us. But as I've been emphasizing before, it takes a gigantic village and a lot of collaboration across institutions. Breast cancer is complex, it's not just one disease, it's an umbrella of diseases, and consequently, clinical trials are becoming more complex. They are demanding the need in clinical trials for collection of blood specimens and tissues, biopsies from the breast and other places, so that we can better understand in the lab what we are seeing in the clinic. And these are very complex studies, very intensive for some of the larger groups. And therefore, we have begun a few years ago, about 10 years ago, a consortium called the TBCRC, or the Translational Breast Cancer Research Consortium, that has given us an enormous amount of flexibility to design the next generation of studies and also train the next generation of investigators. Komen has been one of the key supporters of the TBCRC, and we are forever grateful. Here is a geographic representation, including some of the most experienced academic breast cancer programs in the US. There are about 19 of us. We have monthly conference calls. We have twice a year in-person meetings. We have had a number of successful clinical trials, new knowledge, new science, new papers, presentations at meetings. This has been a phenomenal. And we essentially have a mission statement that is not very different from what Komen tries to do. We are a collaborative effort. We try to design innovative, high-impact clinical research that is driven by science to reduce the burden of breast cancer. We believe in a multidisciplinary approach to understand biology of breast cancer, test new treatments for patients before surgery, patients with advanced disease in the adjuvant setting, and also concepts in prevention. We work together. We want to do it fast. We want to be able to share knowledge, share tissue, share clinical data, and ultimately move this forward. This is a laundry list that I will not try to go through, but just to give you an idea of some of the themes that we are addressing in the TBCRC regarding breast cancer. In triple negative breast cancer, in estrogen receptor positive disease, in HER2 positive disease, also regarding how to better care for patients in regards to their local therapy with surgery and radiation for patients with advanced disease, We're trying to identify better biomarkers, and circulating biomarkers would be the concept of liquid biopsy, where you can obtain a blood sample and learn a lot about the presence of disease, and also in patients who have completed all their treatment with early stage disease, is it possible that a liquid biopsy may help us identify who may still be at risk for recurrence in the future, and for instance, could be a candidate for longer duration of adjuvant endocrine therapy with anti-estrogens if they have estrogen receptor positive disease. And all of you may have heard about the enormous developments, important developments in immuno-oncology, ways of modulating, of harnessing the power of our immune system to fight diseases. This is a concept that is far further along in other diseases, and we're still learning how we might potentially use this in breast cancer in combination with many of the successful strategies we already have and have been fortunate to have developed over the last 4 years. As I mentioned before, the TBCRC is a unique platform. It is a fantastic opportunity for junior and younger investigators. We have a unique setting in that every single institution brings an advocate representing each of the 19 institutions. We have 19 advocates together with us at TBCRC every time we meet, so we can hear the voice of patients, the voice of families, to make sure that the science, the studies we propose make sense, are relevant to the needs and concerns of patients. We're beginning to look into patient-reported outcomes. At the end of the day, this relationship with advocates keeps us honest, keeps us grounded. We also have representation from the leaders of the NCI National Clinical Trial Network and the Breast Cancer Steering Committee. I'm a member of the steering committee for the NCI Breast Cancer group. And this has been unique in terms of our idea to consolidate and coordinate the transition of ideas, for instance, from the TBCRC to national studies. We have great real-time conversations with regulatory individuals facilitating the development of new ideas and implementation. The devil is always in the details, how to make great ideas work in clinical practice. And the consortium has leveraged foundation support. To give you an idea, we have been very successful in providing letters of support to our investigators who go on to submit grant applications to the Department of Defense, to the NCI, to other organizations to do science with the clinical specimens and the data that we collect as part of the TBCRC. And this is a way to leverage the investments that our supporters, such as Komen and ultimately all of you, have provided the TBCRC and ultimately amplify the impact of your efforts, your dollars. So to summarize, significant progress has been made to understand and treat early stage and advanced breast cancer. This partnership between all of us, academic institutions, foundations, other funding entities, are essential so that treatments and cures can be discovered. We can reach our common goal. And if you want to remember just one sentence, no money, no mission. And I don't say that lightly. I think it is incredibly important to have the ability to have resources at the table, especially at a time when funding from the National Institutes of Health has become flat. And in fact, we have lost funding when adjusted for inflation. We cannot be more grateful, could not be more grateful to our support and collaboration that we receive in our relationship with Komen locally in Maryland, but also Komen headquarters, and the ability to get us all together at a national level to advance science and ultimately provide the best possible care to patients. This is an example of how dollars raised by Komen are being put globally out to support research in terms of knowledge, in terms of biology, the causes of cancer, early detection, looking into cancer control, survivorship, and outcomes, quality of life, treatments, and prevention. The list goes on and on and on. And it is just fascinating, amazing to see what is going on. Bottom line, research saves lives. Data are so important, evidence, facts. It is so critical that we have solid foundation on all we propose and all we do. Because of this, the death rate for breast cancer is more than 30% lower than it was 25 years ago. And as I mentioned before, the number of survivors continue to increase. But it is so important. I was recently last week at the American Society of Clinical Oncology when President Hayes gave a beautiful presentation and showed a slide that scared us enormously. We could see, based on geography, the risk of patients dying of cancer and not surviving. And ultimately, where a woman lives should not determine if she lives. Geography should not matter regarding the quality of care that you receive. Komen has been a leader in efforts against breast cancer and has thus far funded research in 48 states and 21 countries. The efforts by Komen span the breast cancer continuum from basic biology to treatment and survivorship. And this is guided by a large number of leading scientists and advocates, including members of the Scientific Advisory Board, many of you who have a role as advocates, also many of the scientists who form the body of Komen scholars. As I said so many times already today, it takes a village. And this is our small village with many of my colleagues at Johns Hopkins, but it takes a much broader village. And these are some of us with our colleagues at Komen, Maryland, in a recent race for the cure. So thank you very much for joining me today. Good luck with the 3-day event, and thank you so much for doing it.